Hello, I'm Teresa. Thank you for being here today. Hip pain is something I see quite often in my clinic. What I find interesting is that people don't all describe it in the same way. Some tell me walking has become difficult. Some say getting out of the car is uncomfortable. Others simply miss doing the little things they used to enjoy. Even though they all call it hip pain, every story is a little different. That's why I like to share how I usually think about it in my clinic. One thing I've learned over the years is not to rush. When someone comes in with hip pain, I don't immediately think about treatment. I like to listen first. Sometimes what patients tell me is more important than where they point. The pain may look similar from the outside, but the reason behind it can be quite different. That's why I believe every patient deserves an individual approach. One thing I often do is combine acupuncture with gentle movement. After placing the needles, I may ask my patient to slowly move the hip, just a little, nothing forceful. Sometimes we bend the hip. Sometimes we gently turn the leg. Many people are surprised that I ask them to move, but quite often they smile and say, "It actually feels easier." I always enjoy seeing that. When something hurts, it's natural to become careful. I completely understand that. But I've also found that gentle movement can sometimes help people regain confidence. I'm not asking anyone to push through pain. It's simply about helping the body remember that it can move again, little by little, at its own pace. Quite a few of my patients tell me their hip feels worse on cold days. When I hear that, I often think about adding Moxibustion. The warmth is gentle, relaxing, comfortable. Sometimes patients close their eyes and simply say, "That feels really nice." Those little comments always stay with me. One thing I've learned is not to focus only on where the pain is. Especially with older patients, I also pay attention to the lower back. From a traditional Chinese medicine perspective, supporting the lower back can sometimes become an important part of helping the hip. I like to look at the whole picture instead of just one painful spot. People sometimes ask me, "Do you always treat hip pain the same way?" The answer is no. Some patients only need acupuncture. Some benefit from cupping. Occasionally, I may add bloodletting. It all depends on what I find during the assessment. Every treatment is a little different because every patient is different. One of my favorite moments is when treatment finishes. Patients stand up, take a few steps. Sometimes they stop for a second. Then they smile. Often they say, "It feels lighter." Those small changes might not seem dramatic, but they always make me happy. After treating many people with hip pain, I've realized something very simple. It's never just about the hip. Every patient brings a different story, a different body, a different life. As practitioners, I think our job is to listen carefully, observe patiently, and choose the treatment that feels right for that person. That's something my patients continue to teach me every day. Thank you for spending a little time with me today. I hope sharing some of my clinical experience has been helpful. If you'd like to join me again, I'll be sharing another reflection very soon. Until next time, take care and thank you for watching.